Hello, my name is Robin Lake. I'm a clinician at the Family Service Center, and I'm happy to be with you today. You've met Dr. Renee Dominguez, our executive director, in the first weeks of the series, and we're delighted in this wonderful partnership with the Village of Northbrook to talk to you about coping during COVID. Today, I'm going to bring together some of the concepts we have learned and highlight them in a strategy that is a whole framework for mental wellness called mindfulness. So today's session might be a little bit longer. Sorry for that. Grab your notebook or your learning tracker, and let's start off by remembering the concepts from the last few weeks. Our topic today is mindfulness. It's a big topic, so we won't be able to cover everything, but many of the concepts and principles of mindfulness are part of the tools that we've already covered. So I'm going to save the review of our learning and recap at the end rather than now. Mindfulness, like all of our tools, has some guidelines, but you will make it your own, adding your own flair to make it work for you. Mindfulness is really like a bird with two wings, awareness and compassion. It is being aware, purposefully being present, noticing what's happening right now without judgment, without evaluation, but rather with compassion. Awareness and compassion, which is also sometimes called non-judgment. It's consciously choosing the self-talk that is a narrator or a journalist or maybe a friend. It's saying, here's what I know for sure, like sensations. I hear Robin talking. I see the computer screen. I am sitting in a chair. Or here's how it is right now. Right now I feel, right now I notice, right now I think about. So there are practices that help us live mindfully, and there are principles that help us live mindfully. And the goal is really to be able to choose where we put our attention, to tune in, notice, be aware, which can also be called pause, and then reflect, have compassion, be honest about what's really happening, be accurate with our thoughts, and then choose our response. So live with intention. So this is a framework for mental wellness, this practice of being aware with compassion, and it's a big part of the tools that we've already discussed. So it's easy to say, be here now, but how do we do it? Most of us need to practice and train our minds to notice. We need some help coming away from autopilot, from listening to and believing the running commentary in our minds. Our minds are always busy, and usually our thoughts are about the past or the future, often with lots of judgments and fears and worries. So it takes practice and effort to tune in to awareness with compassion and gentleness to that narrator, journalist friendly voice in our minds. The formal practices are very effective in helping us train the muscles that allow us to choose where to focus our attention, choose to be present and aware without judgment, without the autopilot. These formal practices are usually called meditations. One thing to keep in mind, you cannot fail at meditation. The point is to notice your mind wandering and bring back your attention to whatever you've chosen as an anchor as many times as you need to. There are also informal practices that are very effective in helping us to pause, reflect, and live with intention, to be aware and compassionate, to live mindfully. Things like mindful chores, like washing your hands and really smelling the soap, feeling the temperature of the water, seeing the bubbles, feeling the strength in your hands, and noticing that these have always been and always will be your hands. Another option is taking a mental picture, really leaning in and noticing a loved one's face or the view out the window and the way that it changes slowly over time or all at once if suddenly there's more snow. Mindful communication is another strategy, informal practice that is really helpful. Listening to what someone says and then responding, you can use validation here. It helps to deepen our relationships and be more effective in our communication. And cultivating mindful qualities is all about the principles of mindfulness. So, the principles of mindfulness are where the primary mental health benefits are, and they are concepts that you have heard about and used in the tools that we've presented. Non-judgment, the practice of taking something as it is without comparison or evaluation. Beginner's mind, sort of remembering that we don't know the future. We can approach things as a beginner, as a newcomer to each experience. Curiosity, seeking information. Are there any other interpretations, anything else to know about what I'm experiencing? And patience, allowing things to unfold at their pace. These are really all important in the cognitive triangle, in our catch, check, and change, and in our stopping unhelpful worries. So when we recognize that we can change our thoughts, that our thoughts are just thoughts, they're not inescapable truths, we are not fortune telling, we can shift. And these principles really help us to do that. Some other principles that we've already kind of highlighted are compassion, tenderness towards our humanity with all of its imperfections, trust, just allowing that things can work out. Maybe they don't need to be solved this very second. Kindness, just a friendliness, gentleness, and acceptance. The practice of being with, of not fighting and arguing with the reality of what's happening. These are a big part of what helps us with setting boundaries, with self-talk and mindful compassion, mindful self-compassion that we did, and calming our stress response system and validation. Gratitude is another tool that we've discussed, and it's a mindful principle. And sympathetic joy is a wonderful principle that reminds us any good is good. We don't need to rank order the goodness. We can turn away from comparing goodness. So the flowers you see on the slide, each flower is beautiful, and the beauty of the hibiscus doesn't damage the beauty of the rose. So sympathetic joy supports our ability to be grateful and enjoy what we have without comparing. Two more principles are impermanence, which is the recognition that everything changes, that this moment will pass. And that relates to the stress response system, the cognitive triangle, to self-talk, to validation, letting go of the need to solve the problem, things will shift, and non-striving. And non-striving can be tough for many of us. It's the idea that there's no particular outcome that is necessary, that there's no goal other than to be yourself. This doesn't mean that we don't try, that we don't grow, that we don't plan to get better at things. See above impermanence, right? We will change, we do learn, but we do that as ourselves, recognizing that you are enough. There's not one right answer, there's your answer. And your value is never tied to one particular outcome. We're able to live with what is, and this relates to all of our tools as they all endorse flexibility and the idea that we are a work in progress, that we can survive, adapt, and add value in any situation that we face. So mindfulness is a much bigger topic than we can really cover in this brief presentation. So I wanted to give you some resources because we've just scratched the surface, but you really have been doing mindfulness throughout this whole series. So I've highlighted a few websites and apps, Calm, 10% Happier, and Waking Up, and the website's on the slide. So pausing and reflecting about mindfulness. What aspect would you like to learn more about? Which informal practice would fit in your day? Which principle do you already use and feel comfortable with? And intending, as you take a minute to plan how to use mindfulness to enhance your coping this week, how can you be present more often? When can you practice mindfulness? What resources would you like to try? Consider committing to a plan of action. I hope this is helpful to you, and I look forward to connecting with you next week.